It's time for the health segment, and we're going to have a DIY segment, sorry, and we're going to have a conversation with our dentist who's joined us. And the discussion is about how to brush your teeth properly. Now, this will be quite interesting for a lot of us because we don't know that the way you've been brushing your teeth has been all wrong. You've gotten all wrong. But we're going to talk to the dentist this morning and find out how to do it properly. All right, so I have been joined by the doctor, Dr. Francisca Nyarko Sarfo, and she's going to take us into this morning. Good morning, doctor.
Good morning.
How are
David.
you?
I'm good.
Fantastic. It's good to have you here. Now, how often do you find that when people come to the dental clinic that with issues with their teeth, that part of the problem has been that they've been brushing their teeth all wrong?
Yeah. Apparently, when you look at the statistics of dentistry in relating to decay and destruction, we realize about 40% come from the way we brush our teeth.
Okay.
So normally when people come to the dental facility, as part of our conversation with them, we have something we call the past dental history.
Okay.
And in that we ask them how they brush their teeth, the frequency at which they brush their teeth, the materials they use to brush their teeth.
Okay.
All these things play a role. And most of the times we realize that the technique as which they use, they use to brush their teeth, is mainly the issue of leading to the decay, the destruction. Exactly.
Ah, I see. Okay, so how often should one brush their teeth?
Ideally, you need to brush your teeth twice in a day.
Twice
morning
a day.
and evening.
Okay.
And I must say the evening one is even more important than the morning one.
How come?
Because during the day, we are speaking, we are moving, we are eating, so saliva is produced in high quantities, and these salivas contain certain organisms that help prevent the tooth decay. But at night, your mouth is closed for over 12 hours, 8 hours. So the organisms have more time to work on your teeth. So it's more important that you brush your teeth.
You have to brush your teeth.
Exactly.
It's far more important even than the morning one. Okay, good. So now let's look at the elements for brushing our teeth. We have the toothbrush, first of all. I notice sometimes I go into certain shops, you're buying toothbrush, and then the toothbrush one is very, very hard. And then there are some that are really soft. Okay. Which is better? Which is more important, or which works better? How do I choose the correct toothbrush?
Oh, okay. So I will start by saying we have 3 types.
Okay.
We have the soft, we have the medium, and we have the hard.
Okay.
Everybody needs the soft, but people don't know. They go for the hard.
Okay.
The hard is what is giving us a lot of issues, especially in Ghana, because of the lack of education concerning those types. Because the hard is what is giving us the diseases, the gum diseases, the bleeding. So ideally, we all need a soft one, a soft bristle toothbrush.
But some people feel that soft toothbrush is not doing any work. I need something that really works.
The truth of the matter is the technique.
Okay.
Not the hardness. Because when you look at the tooth, it has certain spaces, certain anatomy. Okay. So you need a technique, not the hardness. And the soft one is what is enough to take off your tooth. Okay. The hard one, basically, we recommend for people who taking tobacco, who taking coffee because of the stains.
So is that why you have what they call the smoker's brush?
Exactly. As the name suggests, it's for smokers.
Okay.
And even with that one, we don't encourage them to use it daily, once a while, to take care of the stains.
So soft brush is the way to go.
Exactly.
All right. Now, what about the toothpaste? I noticed that some people say, mix some charcoal, and all of that. There's different ideas about what to use, okay? What's the best toothpaste for brushing? Okay.
So when we talk about the toothpaste, we have certain composition that is ideal for your teeth. And the one of the most important one of them is the fluoride, which we don't have it in the charcoal. The reason why the charcoal is working for people because it contains something like sodium that we normally use for bleaching.
Okay.
So, but we need the fluoride. The fluoride is one most important thing that helps the tooth.
I see.
So any toothpaste that contains this fluoride is ideal.
Okay.
But we must also take notice of our environment, especially when we check the upper west, upper east. Their water already contains a lot of fluoride.
Okay.
And you need a certain amount of fluoride. Too much of everything is bad. So for those areas, they already have the fluoride in their water. So there's no need adding another fluoride with the toothpaste.
Okay, what happens if you have too much fluoride?
Okay, what happens is when you have too much fluoride, we call something, we have a medical term called fluorosis. And that one, you see a discoloration of your teeth. And too much of it also can even lead to a systemic issues. Diarrhea, vomiting, and it can even lead to death.
Okay. I lived in a certain part of the continent. I won't mention exactly where, but I noticed that a lot of people had browning of the teeth. And somebody suggested it was the water. You know, and is that, from what you're saying, it sounds like that's possible.
Exactly.
Okay.
So we need to get in touch with the water supply system in every district to find out whether there is fluoride in the water or there is not.
Okay.
In some country, they have fluoride in the water. In some country, they even add fluoride in their milk, their salt. So you need to find out.
So in that case, you should avoid fluoride in your toothpaste because it's too much.
If the amount in the water is too much, there's no need getting a fluoride toothpaste.
Okay, I see.
But apart from that, everybody needs fluoride.
Okay. All right, so then let's take us into brushing the teeth. What's the technique that we should use when brushing that would work perfectly?
Oh, okay. So when we talk about brushing technique, we have quite a number of techniques. But before we go into the technique, we have a normal way that people brush their teeth, which is the most common one, by which this technique is what is killing the tooth.
Oh, really?
So we will demonstrate that old technique, what we normally do.
Okay, so
then we'll go on to the ideal technique, which is necessary. And which
so what are we looking at here on the screen?
Oh, okay. So when we look at the screen, it's teaching us about the right technique.
Okay.
And the right technique, we call it the modified base technique.
Modified base technique. Okay.
And with this technique, you see with the upper left side, you will notice that the toothbrush is going up to the gingival region. That's the pink or the
of the
that
gum.
side.
Yeah.
And when you look at the next picture on the same upper side, you realize it goes up and it comes down.
Okay.
It doesn't go sideways. It doesn't go.
So it's supposed to be up and down the teeth.
Exactly.
The teeth up and down. Okay.
Exactly.
Okay.
And when you come down, you know, we have the upper quadrant of the teeth, left and right.
Yes.
We have the lower quadrant. And the lower quadrant, we have the inside and the outside. So when you look at the lower part, you realize the inside, the toothbrush, is also going in and out.
Okay.
It's not like you're scrubbing.
Okay.
It's going just in and out.
Ah, okay.
And at the anterior portion, that's the front side, you realize the toothbrush is still going, it's kind of raised in a vertical position, going up.
Which number are we looking at?
That's the number 4.
Number 4, okay.
It's going down and up.
Okay.
Down and up.
Okay.
And you look at the up one of the number 4, it's also going down and up. And the last one is going at the where we chew. We call it the occlusal surface.
Okay.
It's just going exactly on the occlusal surface.
So like on a surface motion,
Exactly.
as in scrubbing the face off the
Yes.
teeth. Okay. So maybe you can help us to understand it even better by showing us with the model that we have here.
Okay.
Yeah.
So first of all, this is a dental model.
Okay.
Containing all the teeth. Ideally, everybody should have 32 teeth.
Okay.
But some, because of their jaw position, some have, you can see I have small jaws. You have a little bit broader jaws.
So some people don't have the full 32?
Yes.
Okay.
And it's not because the last wisdom teeth is not there. It's because their jaw is too small that it can't accommodate it.
Okay.
So you take an X-ray and you realize this wisdom teeth is still inside the bone.
Oh, I see. Okay.
Yes.
So it couldn't come out.
Yes. But sometimes it tries to come up and it only shows the tip.
Okay.
And it gives a lot of pain. So people come and take the wisdom teeth out. So
Okay.
this is the dental model. I'm going to show you first of all what people normally do.
Okay.
That is
Fantastic.
creating
Let's take a look at that.
all these dental issues.
Okay.
We know that when people take their toothbrush in the morning, all they care about is they want to brush their teeth.
Yes.
And ideally, you need about 2 to 3 minutes to brush your teeth. Not less than that.
Yeah.
But sometimes 5 minutes, sometimes 1 minute. You need 2 minutes. And we dentists suggest that you get a music that lasts for 2 minutes. So that as you brush your teeth, you listen to the... Exactly. By the time the music ends, you are done brushing your teeth.
Okay.
So people take their brush in the morning and you see them going like this.
Yes. Yes. And that's wrong?
That is wrong, because when you do that, you see the gum.
Yeah.
It's like you are causing erosion of the gum. So with time, you realize your tooth had become longer than it used to be.
Okay.
You are exposing, exactly.
Okay.
You are exposing the root.
Okay.
And when that happens, you start having sensitivity.
Okay.
So people say, oh, when I take cold water, I can't stand it.
Okay.
It's because they are already exposing the root. And the root contains some nerve tubules.
Yeah.
And you start having the sensitivity.
Okay.
So this way should be avoided. It's what is causing the loss of teeth in old age.
Okay.
You are supposed to die with your tooth.
Okay. Supposed to die with our teeth intact.
Yes.
Okay.
That's saying that, oh, you take care of your parents,
Yeah.
and they also you take care of them, so their tooth is lost. It's not ideal. You're supposed to go with your teeth. And because of some of these instances, that's why we are losing the tooth. So the ideal technique is, okay, you take your toothbrush and you go, just as we saw in the picture, you go from up, down.
Okay.
With this in mind, you are actually brushing off the debris.
In between the teeth and on the
Exactly.
teeth. Okay.
So you go up and down, not this way, but you go up and down.
Okay.
So you are taking it off.
Okay.
So you come up.
Okay.
Then you do the same thing for the same side.
Okay. So that's how you're supposed to do it.
Exactly.
Okay. Now, so my teeth are set like this, all right? Is this okay?
You can do it, but gently.
Okay.
It's not how hard you brush, but the technique of brushing.
Okay.
So you can go.
Okay, that motion.
Exactly.
Okay, up and down, but
We also have another technique we call the circular technique.
Okay.
And that one, a lot of people normally don't find it. It's not easy. They are not used to it.
Yeah.
So, but normally that one goes like this. It's like you're going in
surface.
circles. Yes.
Okay.
So after you finish with the outside, you open up. Then with the inside, you go this way.
Okay. Okay.
In, out.
Removing all
with
the
this
debris
one, you are
from
not
inside.
causing damage to the gum. You are just going exactly at the base of it and coming up. That is why you don't need a hard to brush.
Okay.
Because with a hard to brush, even if you go this way,
you'll
it's
still hit the gum.
So then you come to the anterior surface, as we saw. You go this way.
Okay.
With your hand positioned at about 45 degrees.
Okay.
You go. Then with the lower one to the same technique.
Okay. But this looks like this is news, because I'm sure people are watching us are wondering, how come we didn't know all this all along?
Exactly.
Okay, so who gave us the wrong technique? Who's responsible for the lack of knowledge of the right technique to brush our teeth?
I think people call something general knowledge. People had the wrong information. And in Ghana, people normally don't visit the dentist, so they have a toothache.
Yeah.
So by the time they come, toothache actually kills. Recently, we lost about 3 cases of toothache.
Toothache kills?
Exactly. Because, the head and neck is highly vascularized. We have a lot of blood vessels. So any infection there spread very fast.
Okay.
And we have spaces, muscles, everything under it. So the toothache, if not treated, some people even put so many things inside. Car, battery, everything.
Hey.
Exactly.
Wow.
We see them all the time. It spread down to the neck and it spread to the chest. We even end up going to puncture their lungs to drain fluid. And
From
recently, we just lost 3 patients. Exactly.
Wow.
So it's very, very important. And the last thing is with the tongue. A lot of people brush their teeth and forget the tongue.
Okay.
But most of the halitosis of the mouth odor we are having is sometimes from the tongue.
Okay.
Because
why is the tongue that important?
Because the tongue, you take in food through your mouth. Anything that goes through your mouth falls into the tongue before it's swallowed. So you have a lot of stains, a lot of food debris, everything here. When you chew, once you take in water, some of them actually
wash off.
Exactly.
Okay.
So the tongue ideally is supposed to be kind of a pinkish in color or a little bit red, but you find certain tongue very white.
Okay.
And that is as a sign of a candidiasis infection or certain organisms.
Oh, I see.
That's already taken care. And those things give mouth odor. So as soon as you brush your teeth,
you should brush the tongue as well. Okay.
And in the night, when you brush your teeth and you are comfortable, some people they are not comfortable with it. But when you brush your teeth in the night, don't rinse all the toothpaste out.
Okay.
Leave some in your mouth and sleep with it.
Okay.
The toothpaste contains certain antibiotics, fluoride, that will take care of your teeth whilst you are asleep.
I didn't know this. Interesting.
Now you know.
So help us to understand also, whilst we're talking about this now, what's the role of mouthwash?
Okay. So mouthwash, ideally, is not to take care of the debris in your mouth. It's supposed to, one, help you with the odor in your mouth. Some of them have peppermint and other things. Some of them also have antibacterials. Because sometimes when you get the gingivitis and everything, the organism have already taken control of the soft tissue. And you have sores and everything. So these antibiotics, because when you're taking the tablet, it's just going through systemic before it starts working. But when you're taking the mouthwash, it goes inside. So mouthwash is not supposed to replace toothbrush. Because some people think if I don't brush my teeth, I can just rinse my mouth and I'm okay.
Okay.
No.
Okay. Would you recommend brushing your teeth and then using the mouthwash every time? Is it important? Can you completely avoid mouthwash?
Yes, you can completely avoid mouthwash.
Okay.
And mouthwash is not supposed to be used every time.
Okay.
Even with some of the mouthwash, they are actually a little bit high in concentration. So we normally recommend them for 2 weeks. Or once a while, if you think you're having certain odor, you can just use it.
Okay.
But it's not something you should be doing all the time.
All the time, okay. All right, so why would anybody say, okay, let me use mouthwash as part of my daily routine? Why do people opt for that?
Okay.
Is there a reason?
Yes. The first reason is with my experience at work. I've realized most people use it because they felt like it's a must, and they felt like that is what is going to make their mouth smell good.
Good, yeah.
That's what is going to prevent them from having certain caries and other things. But that's not the ideal thing.
Okay.
Others also use it because they don't want to brush their teeth, and they are in a hurry and they want to rinse their mouth and they
just
go.
quickly rinse and go.
Some also use it because they have infection. And they have ulcers and other things, so they believe that the mouthwash, some of them are concentrated, they don't even dilute them. So when they push in, it's hot, so they feel like when they're feeling the burning sensation, it's actually it's working. So, but you normally use it once a while. You can use it, or when you're having, normally should be prescribed by a dentist, because some of them you have to dilute them.
Okay.
But people don't know. So when they use the one that is not diluted, they also develop certain condition.
I see.
And they come back again.
Okay. We're almost wrapping this up, but tell us about floss. The importance, the use of floss. Why floss at all?
Floss is very, very important.
Okay.
Very. Everybody needs to floss. Because when you look at the teeth, you realize there are some spaces. We call them interdental spaces.
Interdental spaces.
And this toothbrush can't really go. There are some people, they have spaces in their teeth. Some too don't have spaces in their teeth.
Yeah.
So if you are lucky and you have spaces, which is not the ideal type, but the ideal one is not supposed to have any spaces. But if you have spaces, you can easily brush in between.
Yeah.
But when you don't have spaces, the food debris and organism normally like hiding in those spaces, which your toothbrush cannot reach.
Yeah.
So you normally want to floss. You can do it before brushing or after brushing, and after eating. And I must say we should stop using the toothpick, because it's also giving us a lot of issues.
What's the toothpick doing that's wrong?
Yes, so you see, a lot of people, when they have meat and other things in between these teeth, they just take their toothpick and they go. You see the anatomy of the tooth, you see it curvy. Once you traumatize the gingiva, there
Which part of the gingiva? Is it a gum?
Exactly.
Okay.
This side is the gingiva.
Okay.
That's what we call the gum.
Okay.
So once you traumatize, there's now space or a loop or an opening causing the organism to infect. So you see people with time, it's inflamed, and when they brush their teeth, they are bleeding.
Okay.
It's because of the
toothpick.
The toothpick.
Poking. Okay.
And with time, the toothpick can also lick it deep down the gum, causing a lot of infection, and later you realize your tooth become mobile with time.
Wow.
It takes a while.
Wow.
And some people don't even know how to use the toothpick. They just take it and they're just going like it because they really want, they feel uncomfortable. They want to get whatever that is there out.
Yeah.
So ideally, you should floss before brushing or after brushing.
Okay.
And when you eat after eating, you should rinse your mouth and just floss.
All right, fantastic. Well, we've been speaking to Dr. Francisca Nyarko Sarfo, who's been helping us to understand how to brush our teeth properly.
Hi guys, I hope you enjoyed this video.
Subscribe to our YouTube channel, The Citi Tube.
For exclusive breakfast daily content and other Citi TV programs.
Like, comment, and share with your friends.